Hey everyone, Adeline here. This particular video are for people that care or for people that are going through the problem. It's a medical diagnosis called chronic pain condition. Now, there is truly a medical diagnosis called chronic pain condition. And it used to be up until about 2014 that you could get proper pain management, which could have anything to do with after a surgery, say a C-section, or say after a back surgery, you were given medication in an opioid form, because they do make that, and it helped you to rehab yourself, physical therapy, whatever you needed. And yet, chronic means that the condition has stood around for about 4 to 6 months without any break. And today we're going to talk about chronic pain. Yeah, so there's been times as a nurse as well as a patient where, there's so much pain you want to escape your body. Of any women I know that had natural childbirth, there was a time when it didn't feel good, right? Luckily you knew you'd be out of pain. Those folks that have chronic pain, though, know that they're suffering needlessly as a result of the DEA, the government's big deal of watching the doctor's license who takes care of people with a chronic pain condition, and has decided that nope, 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 we're not doing that anymore. Opiates, there's a crisis. I've been down this road before. And what that essentially did over the past 2 years was it took people, just normal people that followed their doctor's orders to feel better in our allopathic medicine. That's a whole topic of itself, but where you go to get a pill to feel better or a surgery, yeah, that doesn't work, usually not. And then you find yourself in constant unrelenting pain, which takes away from the big deal, which is called quality of life. And that sucks. So yeah, I just want people to know out there, not just the chronic pain patients, but the people that could be chronic pain patients, this is terrible. I mean, not only did the DEA insist that the doctors to keep their licenses stop all opioids or anything that feels good, benzos, soma, that's a muscle relaxant, anything that makes you feel woo, feel better, by the way, go away. And with some opioids and some very delicate patients, that'll kill them. But what kills them more is suicide, because you're trapped in a pain body and it's not made up. You really do hurt. And so I just wanted this to be an introduction to, basically to honor, as well as to let the people that are in chronic pain know that you're not imagining things, right? And that you could have died just from the detox. You're lucky you didn't. And no, marijuana does not help that type of pain. And I wish it did. And quite frankly, it should piss everybody off that's got chronic pain. I mean, if you're going to commit suicide, you might as well be pissed. Anyway, I'm going to leave it at that for now and see how many people respond. I'm going to do like a little bit of more information concerning reasons why we may need to take our healthcare into our own hands. It may even be corona related. So anyway, I'm going to put that out there. I've been reading a lot of things from a particular video I watched a few years back on this opioid crisis and people suffering and committing suicide, right? How convenient. And doctors not doing their job. And they need to be, put to task. So anyway, if there's anything I can do to help, let me know. Put a comment down there. Or just let me know if this is still a problem. Thank you. Bye-bye.